My topic name is ICD-10, the International Classification of Diseases. 10th revision ICD-10 is a globally recognized coding system used for diagnosing and categorizing diseases, health conditions, and various other health related issues. Developed by the World Health Organization (WHO). ICD-10 is part of a larger family of classification systems that aim to create a common language for reporting and monitoring diseases across the globe. The structure and format of ICD-10. ICD-10 is an alphanumeric coding system that contains more than 14,000 different codes. These codes are used to describe the specific diagnosis and medical procedures. The system is divided into 11, into 21 chapters, each covering each different body system or condition category. For instance, chapter 1 deals with certain infections and parasitic diseases, while chapter 5 addresses mental and behavioral disorders. Each ICD-10 code consists of a letter followed by two digits which can be further expanded by adding one or two additional digits after a decimal point. The codes are structured as follows. The first character is always a letter which represents the chapter or category of the diagnosis. The following two digits specify the condition within that category. After the decimal point, additional characters can be used to provide more detail about the specific condition, such as its severity or location. For example, the code I-10 stands for essential primary hypertension, while E11.9 represents type 2 diabetes mellitus without complications. Usage and importance. ICD-10 codes are used by healthcare providers, insurance companies, and public health agencies for a variety of purposes. They enable precise documentation of diseases and conditions, which is essential for effective patient care. Billing and statistical analysis. The codes help in tracking health trends, planning public health strategies, conducting epidemiological research, and allocating healthcare resources. In addition to facilitating communication within the healthcare system, ICD-10 codes are crucial for rem- reimbursement purposes. Insurance companies require these codes on claims to determine coverage and payment. Accurate coding ensures that providers receive appropriate compensation for the services rendered. Transition to ICD-10. The transition from ICD-9 to ICD-10, which began in various countries during the early 21st century, was a significant shift due to the expanded number of codes and the increased specificity. For instance, ICD-9 had about 13,000 codes, while ICD-10 expanded this to over 68,000 in the US version, reflecting the growth in medical knowledge and the need for more detailed data capture. The transition required extensive training for healthcare providers and coding profession, also as well as updates to health information systems. Despite the challenges, the adoption of ICD-10 was seen as necessary to keep pace with the evolving medical landscape. Global implementation and variations. ICD-10 is used worldwide but different countries may have their own versions and modifications to fit their specific healthcare systems. For example, the United States uses a modified version called ICD-10 CM clinical modification for diagnosis, coding, and ICD-10 PCS procedure coding system for inpatient procedure coding. Thank you.